to make sure.
Hello and welcome into this week's edition of AFMC TV. We're glad you're here. Joining us today is Rebecca Denniston from the dermatology group of Arkansas. So glad you're joining us today.
Yes, thank you for having me.
So May is Skin Cancer Awareness Month.
That's right.
So what types of skin cancer are out there?
Yes, so great time of year to talk about skin cancers right before summer, right before you're out a bunch.
Yes.
There's three main types of skin cancer.
Okay.
The most aggressive form is melanoma. So melanoma is going to be the most deadly form and the one that we worry about the most typically. But then there's also basal cell and squamous cell skin cancers.
Okay.
So those are kind of the three main ones that we look out for in your skin exams. They can come on at any point in your life. So majority of people are going to see those types of skin cancers later in life, but we also diagnose them in younger patients as well.
Is there any place on the body that they particularly like to pop up, or is any surface free game?
Yes. So think about sun-exposed areas. So for men, a lot of times you're going to see them more on the back, especially with melanoma.
Mm-hmm.
On females, a lot of times it's the legs. The face is a very common place, the nose and the ears especially.
Oh, ears.
Yes,
Okay.
especially for men, because a lot of times men wear, ball caps and their ears are exposed. And then also kind of the back of the neck. So places where, that sun is kind of beaming down on your body.
What about your scalp?
Yes, good question. Definitely it can be found on the scalp. Okay. So you can get skin cancer, especially melanoma, in places that don't see the sun. But most commonly, we're going to see it on the scalp in your part line. So, a lot of people wear visors. Mm-hmm. You don't really have that coverage on the top of the head, or maybe you don't wear a hat at all. Yeah. And so your part's exposed and your part may burn, and that puts you at greater risk for skin cancer later in life.
I know you kind of answered this question earlier, but are all skin cancers cancerous?
Yes.
Okay.
Yes, definitely.
Okay.
Now, there's varying types of each skin cancer. So, for instance, a basal cell skin cancer, we kind of say it's the best kind of skin cancer you can get because it's a skimmer. It tends to stay on the surface, typically doesn't dive down like, say, a melanoma would. Okay. And then same for squamous cell skin cancers. Those can be varying types as well. They can be superficial or invasive. So each skin cancer has a different kind of subset or type.
What are we talking about when it comes to treatment? Is it, pretty intense kind of treatment? Or I guess, obviously, it depends on what kind of skin cancer it is.
It does. So melanoma, it's typically a further excision. So a margin is going to be taken around that biopsy site, and then all that tissue is tested again. And so we call those excisions. Mm-hmm. And then for basal cell and squamous cell, the most common treatment is a procedure called a Mohs procedure. And Mohs procedures are a micrographic procedure where the skin cancer is cut out, and then it's immediately looked at under the microscope, that tissue, to make sure that the whole thing is taken out before they sew you back up. So those are kind of the common ways.
And do those happen in the office, or are we going into the hospital for these?
So 9 times out of 10, they're going to be in the office, nothing that you have to be put to sleep for. Okay. Now, there's a rare case if you have an aggressive form of skin cancer or maybe a really large skin cancer that you might have to be, put to sleep for those. But most of the time it's in clinic.
So let me ask you, and I might be dating myself here, but I grew up in the era of tanning beds.
Yes.
As a lot of folks did.
Yes.
And, you always kind of wanted to lay in the tanning bed before you went to Florida.
Right.
So you kind of had your base tan already on. So how is there a window of time that those of us who used to lay in tanning beds, that we need to either begin to be very diligent in dermatology visits or very observant on anything that may be popping up on our skin? Yes. Is there a window of time?
Yes, definitely. I think yes to both of your questions. Okay. So the big thing now, more and more studies are being done on tanning beds and risk of skin cancer, in particular melanoma. So to date, the kind of statistics show that the tanning bed usage increases your risk of melanoma by 70%, which is a huge number.
It is.
So we're seeing more and more younger patients with skin cancer, probably from tanning bed use. So I think a baseline skin check when you're younger, if you have a ton of moles, we may see you in your teens or even earlier. But for the average person, a baseline skin check in your 20s or 30s is a good idea. And then depending upon, if we find anything worrisome or if you have a ton of moles, we may see you for skin checks every year or every few years, just kind of dependent upon the person.
Just keeping an eye on it.
Exactly.
Okay.
Yeah.
SPF. Because that's
Yes.
the best line of defense, right? In addition to hats and clothing and
Yes.
that kind of thing.
Yes.
The higher the number, the better the coverage?
To an extent. So what's recommended is anything SPF 30 or greater. And then kind of once you get around the 50 mark, if you go above 50, there's not much difference between 50 and 100 or 75 and 100. They're pretty equivalent. So the recommendation is anything 30 or greater, and then reapplication is the big thing. So yes, so you really want to apply every 2 hours if you're out in the sun, but if you're sweating or you're jumping in the pool, you really want to do it every hour.
All right. Anything else we need to know?
I think the big thing is, paying attention to your body is super important. So if you see moles that are changing, maybe they're kind of looking different. They're not symmetrical. They have a different color to them. The edges are funky looking, or you have a spot that's bleeding or not healing. Those are reasons to come in and have a skin check.
Okay. Becca, thank you so much.
Yes, you're welcome.
Joining us now is Dr. Melissa Graham from Advanced Allergy Clinic here in Little Rock. Dr. Graham, thank you so much for joining us today.
Thanks for having me, Michelle.
So May, I didn't know this, is food, let me make sure I get this right, Food Allergy and Asthma Awareness Month. Did I get that
That's
quite right?
correct.
Okay.
May is always that month every year. So just to bring awareness to everybody's, food allergy and asthma. So that month is set aside each year to recognize those conditions.
Okay. So when we talk about food allergies, and as I was preparing for our visit today, I was thinking, kind of as I was growing up, I don't really remember hearing a whole lot about food allergies. There were the occasional kids in elementary school that would have a terrible reaction to shellfish, but I don't ever really remember growing up hearing about peanut allergies and dairy allergies and gluten-free or gluten intolerances and allergies and kind of all the different things that we hear about now. And so my question I'm curious to is, have those allergies always been there? Or is this really kind of, as we've grown up and aged, these new allergies have come along as well?
Well, allergies have always been there. There's the classic food allergy, like you remember with shellfish and peanut allergy, but allergies have been on the rise. There's some kind of shocking statistics about peanut allergy, for instance. It has tripled over the last 2 decades. So it definitely has increased, but allergies in general, like hay fever, sneezing, those allergies have also increased over the last several years. And those, it's increasing for reasons we don't quite understand. And even in the United States versus Asia, the incidence of peanut allergy is increasing. And so again, we know more about it and we're studying it more, but definitely the increase are 200,000 emergency room visits, 150 deaths each year from anaphylaxis to food allergens. And those classic foods, like you remember the shellfish allergy, now the peanut allergy, the most common foods that cause that serious anaphylactic immune response are peanut, fish, shellfish, tree nuts, milk, eggs, soy, wheat, and the 9th most common food allergen that got added back in 2020 was sesame seed. And so those are the classic food allergens that cause an immune response, and it's called an IgE, which is the allergy antibody that is made in certain individuals who have the chance of being allergic like that. That's the IgE mediated response, and it causes the drastic can be life-threatening reaction where you have wheezing, hives, usually their skin response in most of those reactions, but it can lead to hives, vomiting, diarrhea. And then what can be life-threatening in those individuals can be swelling of the throat and the airway, which cuts off the oxygen, and then low blood pressure, which leads to anaphylactic shock, so that they don't get good blood flow to their organs like brain and heart and kidneys, and that's what ultimately leads to death in the extreme cases.
Well, I was in hearing you describe what type of a reaction someone might have. That is utterly terrifying. I can't imagine having that experience. And that's the way that you find out, oh, you're allergic to fill in the blank, whatever that
Yeah, and
was that you
peanut,
ingested.
like, 75% of people can react the first time they're exposed to peanut, for instance. They can have a reaction. Fortunately, if it does present usually in childhood, and so the first time might not, it usually is not that severe. There can be warning signs before it gets to that point. So thankfully, the way the immune system works, you are exposed more and more times. And so with future exposures, the reactions become more severe. So you can have warning signs so that you can get evaluated by a physician and hopefully a board certified allergist, so they can give you the tools and the education so that you know how to recognize and avoid those foods, and teach everyone around you to help you be safe. But you can imagine how terrifying that is for families and patients to have to deal with that. And most of these foods you don't outgrow. Only 20% of people outgrow their peanut allergy. 10% outgrow tree nut allergy. Most people don't outgrow fish, shellfish, or seed allergy. But the good news is most everyone outgrows milk, soy, wheat, and soy, milk, egg, and wheat allergy. And so those usually are childhood allergies, and over 80% of people outgrow those by their teenage years. So that is the good news. And we have lots of studies that are ongoing for peanut and tree nut allergy to help kids outgrow those.
You mentioned some of the allergies that we may not be as familiar with. Let's go ahead and touch on some of those.
Right. So there are other, that is an immune reaction that is IgE mediated, and there are other immune mediated reactions that are non-IgE mediated that I heard you mention, like celiac disease. It is an allergy, still an allergy to gluten, and it's an immune reaction where your body develops an allergy to that protein that is found in wheat, and it can cause serious symptoms too. But the skin test that an allergist has, where we just prick your back and look for an IgE antibody that causes a wheal and a flare response, looks like a mosquito bite, that's not a way to pick that allergen up. It can cause GI symptoms, bloating, cramping. It can also cause skin findings. It can cause you to have joint aches, more like an autoimmune. It is an autoimmune process. So it still can cause lots of serious problems and make you feel ill. But there are blood tests that can pick that up. If it's it does usually affect your colon. And so GI doctors can help with that too. So definitely it needs to be evaluated, starting usually with your primary care doctor, to run some of those tests and then to decide who to send you to from there. Sometimes involving a gastroenterologist, which is a stomach doctor that can help with that.
That's great. My one final question that I wanted to ask is, can a person develop allergies at any point in their life? Just because they were born without allergies doesn't mean that they can't develop them later on, or no, if you're born without them, you're pretty good.
Yes, you can develop allergies at any point. You're predisposed with an allergic immune system, and it's very, very linked to your family history. And so a lot of babies, the first sign that you might be an allergic person would be having eczema or atopic dermatitis. And then You could have a food allergy or not. And the most common food allergies, again, that you might develop early on would be milk, egg, soy, wheat, possibly peanut. The foods that you're more likely to develop, though, as an adult would be fish, shellfish, peanut, tree nuts, or seeds like sesame seeds. And the peak age that most adults would develop an allergy would be in their 30s. There is a newly discovered and described food allergen, though, that has been described, I think, since probably 2006, and it's an allergy to a protein and carbohydrate combination in mammalian meat. And that has been something that we've seen related to tick bites, we think, to the Lone Star tick bite, and it's called an allergy, IgE allergy to alpha-gal. And it's after eating meat 4 to 6 hours later, developing anaphylactic symptoms of hives and usually GI symptoms. So that's something that's new that people should be aware of. Usually you wake up in the middle of the night having hives, usually stomach cramps, can pass out. And I think more people are aware of it over the last several years. Usually those people are allergic, but so many people, only about 30% of people are allergic and have hay fever or sneezing. But most people think everybody is allergic to something. But 70% of the population don't have any allergy. They never buy any Kleenex. They never have to use a Claritin. And so it's, 30% of people are allergic and are at risk of having a food allergy.
Okay. Dr. Melissa Graham, thank you so much. I'm excited to have you back because we still have asthma to talk about as well. So we'll get you back on and cover some other topics too. So
thanks, Michelle. I'm happy to come back anytime.
Thank you so much. And thank you so much for joining us. We'll see you back here next week for more AFMC TV.